Is your blood pressure medication causing your erections to go soft? I'm Dr. Rena Malik, urologist and pelvic surgeon, and today I'm going to break down how different blood pressure medications can impact sexual function. Now, high blood pressure or hypertension is one of the big risk factors for actually developing ED. In fact, studies show that up to 70% of men with high blood pressure also struggle with ED. And this is because high blood pressure damages the blood vessels, and that then affects blood flow, not just to the heart, but overall throughout the whole body and specifically in the penis. And when you can't get good blood flow to the penis, it's very difficult to get and keep an erection. Interestingly, high blood pressure can also affect sexual function in women. It's actually linked to decreased vaginal lubrication, reduced orgasm, and increased pain during sex, likely again for similar reasons of decreased blood flow. So no matter who you are, having poor blood pressure can really take a toll on your sex life. Now the issue here is that while we want to treat your high blood pressure so we can improve your erections and your sexual function, the medications that are used to treat high blood pressure can sometimes also cause ED. So it's really important to find the medication that works best for you in reducing your blood pressure without having those sexual side effects, because we don't want you skipping your blood pressure medication just in favor of erections, because ultimately in the big scheme of things, you will notice that those erections will get weaker and weaker as your blood pressure goes unchecked. So before I get into it, I just want to ask you a quick favor. If you guys have watched my channel before, listened to the podcast, and you're not subscribed, do me a favor and do it right now. Guys, only 20% of you who watch the channel are actually subscribed. And guys, it's free, zero cost, easy way for you to support the channel and help us grow. Now, specifically, certain blood pressure medications have been shown to worsen sexual dysfunction. Now, which ones? So older medications like Clonidine and alpha-Mythldopa work in the brain to lower blood pressure. But by doing so, they decrease something called sympathetic outflow. And when you don't have any sympathetic outflow, it means your body has a difficult time increasing your blood pressure and your heart rate. When you think about arousal, heart rate goes up. And one of the ways your body and your brain know that you're aroused is because it sees your heart rate go up. So sometimes when you have a medication that causes a decreased heart rate by whatever mechanism, your brain then can't perceive arousal the same way. And then you have difficulty with erections. Another class of medications that sometimes has issues is diuretics, like thiazides or hydrochlorothiazide. And these medications are diuretics or water pills, and they can affect sodium balance. And this change in sodium balance in our bodies changes the alpha adrenergic receptor, leading to blood vessels becoming more constricted or narrowed. And this ultimately leads to decreased blood flow to the genitals, which means that you just can't get an erection as easily. Now, the last blood pressure medication that can cause issues are things like beta blockers, like Metoprolol or Propranolol. These are non-selective beta blockers. And by blocking the beta receptors, they can cause a decrease in heart rate, again, affecting arousal and libido. They also decrease blood flow similarly because by blocking the beta receptors, they're having a positive effect on the alpha receptors. And again, they're having decreased blood flow. In one study, they found that men taking the beta blocker propranolol had a significantly higher rate of erection problems compared to those who were not on any blood pressure meds. Now, the good news is that if beta blockers work for you, there are more selective beta blockers like carvedilol or nebivolol, which seem to have less of a negative impact. But not all blood pressure medications are bad. Some actually have a neutral or even a beneficial effect. Drugs like angiotensin-converting enzyme inhibitors or ACE inhibitors or angiotensin receptor blockers or ARBs and certain calcium channel blockers have been associated with maintaining or even improving sexual health in hypertensive patients or patients with high blood pressure. Now, the reason for this is that these medications improve blood flow and the function of the cells that line the blood vessels, or the endothelial cells. So by supporting the blood vessels, they're actually counteracting some of those negative effects that high blood pressure has on sexual function. So bottom line, what medications are the best options if you're dealing with high blood pressure and erectile dysfunction? Well, based on the research, we have a few that stand out. First up, angiotensin receptor blockers like Valsartan have been shown to improve erectile function, orgasmic ability, desire, and frequency of intercourse in high blood pressure patients. In one study, they looked at 3,500 patients, and they found that the ARB Valsartan was improving all aspects of sexual function, particularly erectile function. And this is because by inhibiting that ACE, or the angiotensin converting enzyme, this leads to relaxation of the blood vessels and increased blood flow. Next up is calcium channel blockers like amlodipine, which appear to have a neutral or maybe even a slightly positive impact on sexual health. And they also cause vasodilation or relaxation of the blood vessels, which increases blood flow, and don't seem to cause that increase in sympathetic tone or have effects on the central nervous system like other blood pressure medications. And interesting, we talked about beta blockers, but the beta blocker Nebivolol seems to be an exception because it's been actually shown to have slight improvements in erectile function. And this may be because it boosts nitric oxide production. And if you're new here, nitric oxide is the ignition for erections, and you need a lot of that around to be able to have good erections. And of course, it increases blood flow. But before just resorting to medications, it's really important to realize that lifestyle factors play a huge role in high blood pressure and sexual dysfunction. Things like being overweight or obese, being inactive physically, smoking, using alcohol to excess, all of those things can contribute to both conditions, as well as diet. So making changes like losing weight, exercising regularly, quitting smoking, God please quit smoking, because smoking will destroy your erections, can actually improve sexual function in both men and women. And ultimately, if you do those changes with a medication, you're gonna have even better results. Bottom line, this connection between high blood pressure and sexual dysfunction is a bit complex because high blood pressure leads to issues with sex, and medications that we use to treat high blood pressure can also lead to issues with sex. But bottom line, if you're looking for medications, talk to your doctor about angiotensin receptor blockers, calcium channel blockers, and selective beta blockers, which may be better options. I hope you guys enjoyed this video. If you found this helpful, make sure you leave a comment below. Let me know what you liked about it and what you want to learn about next. And as always, remember to take care of yourself because you are worth it.